TAKAYASU'S arteritis is an autoimmune disease. Look at this picture, shows that aorta inflammation. Then ultrasound findings, look at this, to evaluate blood flow. Then MRI and CT angiographies. Then angiography is the gold standard to visualize narrowing arteries. Look at this picture. A detail going on. Introduction. TAKAYASU'S arteritis is a rare chronic inflammatory disease that primarily affects large blood vessels, especially the aorta and its major branches. It is a form of vasculitis that leads to arterial stenosis, occlusion, and aneurysm formation. The disease predominantly affects young women, particularly those of Asian descent, and can lead to serious complications if left untreated. A definition: it is a chronic granulomatous vasculitis of large arteries, mainly the aorta and its major branches, leading to vascular narrowing, occlusion, and aneurysms. The disease is also known as pulseless disease due to weakened or absent peripheral pulses in affected individuals. Etymology: TAKAYASU'S arteritis is named after Japanese ophthalmologist Dr. Mikito Takayasu, who first described characteristics retinal artery changes in 1908. The term arteritis comes from the Greek word arteria, meaning artery, and the Latin suffix itis, indicating inflammation. Types: based on angiographic classification, TAKAYASU'S arteritis is categorized into 6 types. 1. Type 1 involves the aortic arch and its branches. 2. Type 2A involves ascending aorta, aortic arch and its branches. 3. Type 2B includes type 2A involvement with additional descending thoracic aorta involvement. 4. Type 3 involves the thoracic and abdominal aorta along with renal arteries. 5. Type 4 affecting the abdominal aorta and renal arteries. 6. Type 5, a combination of all the above types. Causes. The exact cause of TAKAYASU'S arteritis remains unknown, but it is believed to have an autoimmune basis. Potential causes include 1. Genetic predisposition, 2. Autoimmune reactions, 3. Infectious agents, example Mycobacterium tuberculosis, 4. Environmental factors. Risk factors. 1. Female gender, especially women aged 15 to 40 years. 2. Asian or Middle East descent. 3. Family history of autoimmune diseases. 4. Presence of other autoimmune conditions. Complications. 1. Hypertension due to renal artery involvement. 2. Aneurysm formation. 3. Stroke. 4. Myocardial infarction. 5. Heart failure. 6. Limb ischemia. 7. Vision loss due to retinal artery involvement. Pathophysiology. Pathophysiology of TAKAYASU'S arteritis, step by step process. 1. Autoimmune trigger, genetic susceptibility. The exact cause is unknown, but genetic predisposition, example HLA-B52. Association and environmental factors may trigger an abnormal immune response. An initial immune trigger, such as infections, may activate T cells and macrophages. 2. Immune system activation and inflammation. Activated T cells and macrophages infiltrate the walls of large arteries, especially the aorta and its major branches. Pro-inflammatory cytokines, example IL-6, TNF alpha, IFNU and matrix. Metalloproteinosis, MMPs, contribute to vascular inflammation. 3. Granulomatous inflammation of the basal wall. A granulomatous reaction forms within the arterial wall involving giant cells and macrophages. This primarily affects the tunica media and adventita, leading to thickening of the basal wall. A arterial wall damage and fibrosis. Persistent inflammation causes a destruction of elastic fibers and smooth muscle cells in the arterial wall. Fibrosis and scarring lead to progressive thickening and narrowing stenosis of the vessel lumen. 5. Vascular occlusion and ischemia. Stenosis, occlusion or thrombosis reduces blood flow to affected organs, leading to ischemic symptoms. Common sites include the subclavian carotid, renal, and vertebral arteries, causing lymph claudications, stroke, or hypertension. 6. Aneurysm formation and vessel weakening. In some cases, chronic inflammation weakens the arterial wall, leading to aneurysm formation. Aneurysms may rupture, causing life-threatening complications. 7. Clinical manifestations. Early phase. Non-specific systemic symptoms. Fever, fatigue, weight loss. Late phase. Vascular symptoms. Diminished pulses, bruits, hypertension, lymph ischemia. Takayasu'S arteritis progresses in a relapsing remitting course, requiring early diagnosis and immunosuppressive treatment to prevent irreversible vascular damage. Signs and symptoms. 1. Fatigue, weight loss, and low grade fever, systemic symptoms. 2. Reduced or absent pulse, pulseless disease. 3. Claudication, pain in lumps due to poor circulation. 4. Hypertension. 5. Dizziness and fainting. 6. Chest pain. 7. Vessel disturbances and headaches. 8. Abdominal pain due to mesenteric ischemia. A diagnosis. 1. Clinical examination. Absent or weak pulses, blood pressure differences between lymph. 2. Imaging studies. A. Angiography, gold standard to assess vessel narrowing. B. Magnetic resonance angiography, MRA or CT angiography. C. Ultrasound, Doppler scan to evaluate blood flow. 3. Laboratory test. A. Elevated erythrocytic sedimentation rate, ESR, and C. Reactive protein, CRP. B. Anemia. C. Autoimmune markers, ANA, RF, etc. Nursing diagnosis. 1. Impaired tissue perfusion related to arterial stenosis. 2. Activity intolerance related to reduced oxygen supply. 3. Acute pain related to vascular inflammation. 4. Risk for injury related to aneurysm formation. 5. Deficient knowledge related to disease management. Medical management. 1. Corticosteroids to reduce inflammation. 2. Immunosuppressants. 3. Biological agents. TNF inhibitors like infliximab. 4. Antihypertensives to manage high blood pressure. 5. Antiplatelet therapy, aspirin, to prevent thrombosis. 6. Surgical interventions. A. Angioplasty. B. Bypass surgery. C. Stent placement. D. Monitor blood pressure and pulse regularly. Nursing management. A. Educate patient and medication adherence and side effects. B. Encourage a low sodium diet to manage hypertension. C. Provide emotional support for coping with chronic diseases. D. Promote physical activities with tolerated limits. Treatment options. 1. Pharmacologic therapy. Steroids first line. Immunosuppressants adjacent therapy. Biologic agents for refractory cases. 2. Endovascular procedures. Angioplasty or stenting. 3. Surgical interventions. Bypass surgery for severe stenosis. 4. Lifestyle modifications. Healthy diet, low sodium, high fiber, stress management, and regular exercise within tolerance. Psychosocial medicine. 1. Counseling and emotional support helps patients coping with chronic illness. 2. Support groups encourage sharing experiences with others. 3. Stress management techniques, meditation, yoga, and relaxation exercises. 4. Patient education improves understanding and adherence to treatment. 5. Family involvement encourages support from loved ones for better disease management. Prevention. Although TAKAYASU'S arteritis cannot be completely prevented, the following measures may help reduce complications. 1. Early diagnosis and treatment. 2. Regular follow-ups with a healthcare provider. 4. Controlling blood pressure and cholesterol levels. 5. Avoiding smoking and alcohol. 6. Maintaining a healthy lifestyle. In conclusion, it is a rare but serious inflammatory disease that affects large arteries. Early detection and treatment are crucial for prevent complications such as hypertension, stroke, and aneurysms. A combination of medical therapy, surgical interventions, and lifestyle modifications can help patients lead to better quality of life. Nurses play a vital role in patient education, monitoring, and emotional support, encouraging holistic care for individuals with this chronic condition. Thank you. Have a nice day.